Welcome back and thanks for staying with us. Let's take you to this now. Unemployed doctors are today taking to the streets of Pietermaritzburg in KwaZulu-Natal in protest to what they are calling a healthcare crisis. Last week, the health department blamed fiscal constraints for the lack of employment for hundreds of young health professionals, especially medical doctors who have completed statutory community services programs. The South African Medical Association trade union submitted a list of 825 unemployed medical doctors to the department last month. SABC News reporter Nonhlakanipho Magwaza gives us this live update from the protest.
Good morning. Yes, we are here. We are currently walking down long streets where a group of doctors, it's not all the doctors who are attending this march, the unemployed doctors, it's just some of them who are going to the Department of Health to hand in their CVs and their memorandum to the Department of Health. They've been marching from the top of long streets. We are halfway there, but with me now is one of the doctors who is currently unemployed. Doctor, welcome to our show. Thank you so much. Can you just briefly give us your names and tell us for how long have you been unemployed?
Morning to the viewers. My name is Dr. Andetelelo Sibeni. It's almost been a month now since I've last worked, and it's challenging, as you may know. Something that's totally unprecedented, and it's something that's unfair to us as dedicated and committed healthcare workers who are young and who aspire to make a difference in the South African public healthcare sphere, as we try to uplift the needs of our people who are marginalized and who deserve this much needed healthcare. So it's unfair that they are left stranded because our hospitals are understaffed and doctors are roaming the streets unemployed. It's not fair, actually.
I'm assuming you've completed your 2 years of internship, your 1 year of community service. Whereabouts were you doing your community service?
So I did my community service at Mahatma Gandhi Memorial Hospital in Phoenix. I did my internship at Krisani Baragwanath Academic Hospital in Soweto. Yes.
And we've heard the minister, Dr. Phatla, saying that there were posts, like over 200 posts that were released last year, and they're planning to release another 300 posts. As an unemployed doctor, how do you feel about that number, seeing as it might not be enough for all the doctors?
It's quite disappointing and quite unfair to us as young healthcare professionals who still want to make a difference in our communities. We want to go and serve public hospitals. We want to go to the most distraught communities because over the past 3 years of training, we have acquired skills which we think are going to be beneficial to the people who are out there, who need healthcare, who need services, who need doctors, because it's unfair from the government to release inadequate job opportunities or posts, whereas the needs require more numbers, and actually there are more doctors who are unemployed. It's unfair because they know through ICSP, they know the exact number of doctors who are completing or who have completed community service. So they should avail the number of posts that are in accordance with the number of doctors that they've actually trained over the past 3 years.
Thank you so much.
Thank you.
That was an unemployed doctor. He's been unemployed for a month now. And earlier on, we did speak to a couple of more who've been unemployed for about 10 months, sitting at home after completing their community service. And they said that where they were in the rural areas of the province, doctors are in much need, and they keep getting calls saying that they are needed, but the budget is not there. And the over 200 posts that the Dr. Dr. Joe Patla said that they released last year. They were complaining that them as privately subsidized doctors, they did not get the opportunity to be even looked at, because those posts went to those who held bursaries that were released by the Department of Health. And they are calling for the government to come to meet them halfway so that they can find a solution, because our hospitals are in dire need and in shortage of doctors. With me again is the PSA, the Union, Public Servants Association Union chairperson of the province, who will tell us or paint us a picture of in the province where exactly do we stand in the unemployed or the lack of doctors here in the province. Mr. Ndlovu, thank you so much. Just paint us a picture as a province. How many doctors are we short of?
So if you look at the number national, it's about 700. In our province, it's over 200 unemployed doctors. It's very disappointing, because it seems as if in all the categories, even nurses, there's shortage here. I'm making an example of Escort Hospital, where one of our relatives visited the hospital at 1 o'clock, but she was only attended after 6 o'clock. It tells you that there's a shortage of doctors. To invest to produce one doctor, it takes you more than 6 years. There's a lack of planning, but we must start now, hold them accountable, because we cannot allow this situation where doctors, nurses are unemployed and our members are overworked in all the hospitals. I know they will take the memorandum, they will say they have a plan. We must be able to see the action. As PSA, we have come in support of these young doctors. We are saying other doctors are suffering. They are working over 100 hours in hospital, in CHC. We want to ask the president to be able to intervene. There is no way that we can allow this situation. Otherwise, we're going to lose this investment. Other countries are ready to take young doctors. We need a solution as in yesterday, because our people in public health, they need solution.
What does the shortages of the doctors and nurses do to our hospitals?
It done a lot of damages. If you can go to Prince Mshien today, you'll see that it's overcrowded because there are not enough doctors. If you go to Bethesda Hospital and different hospitals in our provinces, our members cannot be able to cope anymore. We've got a pool of doctors. We have invested over 6 years. A lot of money has been invested. So we are saying to the MEC in the province, they must stop talking, they must be able to act. Because as PSA, we told them to say, you must make sure that you plan for filling off the position. As I'm said, there are nurses who are unemployed, there are community health care workers who have been on contract for over 10 years. So we are seeing the majority of people here are black, and we have invested a lot of money to them. What is the minister saying? They are giving us report. Money is invested elsewhere. You see some of the element of corruption, maladministration, but we must pay attention to the workforce planning. When are they going to appoint them? Hospital and health facilities, they are waiting for them. We can't lose this talent. We want to see a response to them. We don't want them to just take a memorandum. Last year, doctors went on street again. There was no response. The minister, the president must be able to respond, because as a PSAC, we are saying we cannot take it anymore. There are many doctors who live in the country. We want to make sure that we lost many of them. So they must be able to take action. We are united. We support this action. We call all progressive forces to support this action. If they've got a political leadership, the Premier must be able to take action. In Gauteng, there are progress that you see, but in KwaZulu-Natal, we want to see the action. There is money. Money is wasted, must be directed and ensure that they're employed. They must have statistics, how many doctors are produced for a year. They must distribute them to CSC, to district in different level. This 700 or 200 in KZN is not enough to cater for our province. We need action. We need action as in yesterday.
Thank you so much.
Thank you.
That was PSA Mlungisi Ndlovu telling us about the dire need of the shortages of doctors and nurses in our hospitals. Earlier on, we also spoke to a couple of unemployed doctors. They say that currently our province or South Africa as a whole does not meet the requirements of the WHO that says that every hospital or doctor is supposed to be one doctor per 1,000 patients, but currently it's one doctor per 3,000 patients, and that is putting a lot of strain in doctors currently in our healthcare system. Back to you in studio.
And of course, those numbers just don't add up. That was our reporter, Nonhlakanipho Magwaza, just illuminating on this crisis that doctors are experiencing at the moment. Of course, one of the things that we have been hearing from the health ministry, in fact, the minister himself saying that there are a number of issues that some of these doctors are not employed, one of them being budgetary constraints. He also said that at this time, a number of doctors being trained has increased dramatically. If you look at those numbers in January of 2018, we were looking at 1,472 medical interns. At the beginning of 2023, there were 2,265, and now there are 2,210 medical interns for 2024. So it is concerning to see those numbers increasing, and a lot of the doctors on a national scale, of course, not having that kind of employment that is necessary. And as our reporter said earlier, that the ratio between doctor and patient in the country at the moment is at crisis level. We'll continue to bring you this story because it is an important one, especially as we head to, the budget meeting, etc.